Now we're going to see the difference between breath holding spell and seizure. So the breath holding spell is just the transient apnea of the baby, and there could be loss of consciousness rapidly recovering as opposed to the seizure. So let's see the comparison. So here we will put the triggers, and here like the most common population that is involved. So incidence, or I don't know, something like this. The breath holding spell could be divided into the cyanotic type or the pale type. The triggers for the cyanotic type are crying or frustration. For the pale type is fear, minor trauma, or pain. For seizure, this was the triggers. For seizures, the triggers are unprovoked, so no trigger, or secondary to sleep deprivation. And now the incidence, seizure is at any age, but could be most commonly on patients with developmental delay, for example, or febrile seizures. And the breath holding spells, for both, it is most commonly seen between 6 months of age and 2 years, and in patients with iron deficiency anemia. Now the presentation for the breath holding spell of the cyanotic type, the patient presents with apnea, loss of consciousness, but very rapidly is recovering. So with rapidly recovering. For the pale type, the patient has apnea plus bradycardia, paleness, pallor, and here cyanosis, and here plus or minus loss of consciousness, but this lasts certainly less than 5 minutes. So could last a little bit longer than the cyanotic type. And for seizures, the patient presents with loss of consciousness, followed by tonic-clonic movements, followed by the postcoital transient type or postcoital phase that lasts more than 5 minutes. So the breath holding spells usually last less than a minute, but the issue is that it lasts less than 5 minutes, but usually less than 1 minute. And if we suspect this, that the patient has breath holding spell, we would do a screening for iron deficiency, because the patients get better with the treatment. A typical type is if the breath holding spell lasts more than 1 minute. But there are differences not only on the time between the seizures and the breath holding spells, like here we have triggers, and here we have the bradycardia, apnea. This transient apnea could have loss of consciousness but recovery rapidly, certainly not more than 5 minutes.